MSAT is acupuncture with motion, stimulating the muscle while the patient is actively moving. And that decreases their pain or decreases the neurological input back to the brain.
So MSAT is known to be effective for low back pain, but it can also be used for a variety of musculoskeletal disorders, for example, frozen shoulder, temporomandibular joint problems. It is also a valid option for clinical care for stroke patients, especially if they have paralysis symptoms.
I'm impressed by how rapidly the patients respond and seem to have very acute pain alleviated. That's a challenge, I think. Any sort of acute pain treatment is, under many circumstances, often unsuccessful.
MST, that was the first time I'd ever done that. That was the first time I'd been able to walk in high step. I'd never been able to do that for a long, long time without a great deal of pain.
So within 20 minutes of treatment, the patient can actually walk without assistance. So it looks like a miracle. But in fact, there's a lot of science behind it. There are already a lot of studies being done on the mechanism of the acupuncture as a treatment. However, in the Western world, they still carry a lot of doubt about this treatment.
Asian traditional medicine, those two things are probably its weakest points here. Is that number one, the Western Hemisphere, we don't really understand Asian traditional medicine already. And then we have another difficulty when we look at the data, because there's really no good. And right now in the Western cultures, it's all about randomized controlled trials. And since we don't have a great body of randomized controlled trials, the insurance payers are certainly having difficulty paying for that.
If the data supports it, as we've seen it, it lends itself to a much more efficient, high-quality system.
I think there's an art form to treating patients, but I also think that we absolutely need to have the research behind what we're doing clinically to know why what we're doing works. It's not enough just to say, I have a gut feeling that it works.
Jiaseng is doing a lot of good research to collect data to show their treatments are in fact very effective because they use proper control groups. Western medicine is always looking for evidence-based results from Eastern medical research. And if they publish it in a high impact factor international journal, this is the kind of evidence-based results the Western world is looking for.
The College of Osmotic Medicine would be willing to add the Jiaseng technique if we can look at a study that would show, under evidence-based, that it made a difference to our patients' well-being. Anything that we can study scientifically that makes evidence-based, we're willing to add to the curriculum.
The research into the types of things that Jiaseng is doing is critical for all physicians to understand it so they can potentially refer patients.
There's an enormous demand worldwide. I mean, we have billions of people on the earth, and I don't know how Dr. Shin can satisfy the global needs for top health care, but we hope at least processes that are beneficial to patients will become more widespread, really across the world.